Good morning, ma'am. My name is Lady Heart Bulanday, a nursing student from Northwestern University, and I will be your student nurse for today. So, may I know your name, ma'am?
I'm Charlotte C. Tolentino.
Can you state your birthday?
April 26, 2001.
April 26, 2001?
Yes.
Okay. So, Ma'am Charlotte, today I am going to conduct head-to-toe assessment. I will be assessing you from your head to your toe, so that would be okay to you, ma'am?
Yes.
Okay, thank you. Okay, thank you, ma'am. So, I'm gonna proceed to inspecting your skin, head, hair, and scalp, and nails. So, is it okay to touch your skin, head, hair, and scalp, and nails, ma'am?
Yes.
Ma'am, before we start, would you mind to remove all your jewelry and sit properly, ma'am?
Yes.
And may I see your gloved arms? I can see any lesions on your skin, ma'am. Now I'm going to assess your skin texture. Your moisture. And your mobility and skin turgor. Next, I'm going to palpate for edema. Can I see your feet, ma'am? Your other feet, ma'am. Now I'm going to assess your head, hair, and scalp. No lice and dandruffs. There are no lesions and scars. Head size seems to be normal. So I'm gonna palpate your head, hair, and scalp. So it is okay to touch it, ma'am?
Yes.
And tell me if there's any pain. Do you feel anything?
None.
How about here?
None.
Okay, so patient's head size is normal, hair and scalp is normal, and it is smooth to touch. There are no lesions, dandruffs, or any lice. And also, I'm going to inspect your nails. And for the shape, ma'am, can you do this? Okay, I can see the diamond shape. And I'm going to test the capillary retina. So now we're gonna proceed to assessing the face of the patient. So that vertebral feature of the patient seems to be symmetrical and normal. So ma'am, could you smile for me? So the presence of nasolabial folds are present and symmetrical on both on the left and the right side. Now we're going to test the visual acuity of the patient using the Snellen chart. And let the patient stand 20 feet away from the chart. So Miss Charlotte, stand right there and see the Snellen chart and say what line can you read.
7.
Okay, number 7. Can you read it for me while covering your right eye?
F-E-L-O-P-Z-D.
Okay, now cover your left eye.
F-E-L-O-P-Z-D.
Now read it with both eyes.
F-E-L-O-P-Z-D.
So the patient can read the line of number 7, which is 20/25 vision. And that means that she can read the line of 20 feet that a normal person can see at 25 feet. Now I'm gonna proceed to inspecting or assessing your eyebrows. It seems to be symmetrical on the left and the right side. So can I touch it, ma'am?
Yes.
Okay, so the distribution of the hair seems to be even and normal on the left and the right side. So the patient's eyelashes are evenly distributed both on the left and the right side. Both are symmetrical and so ma'am, can I touch your face?
Yes.
So the patient's eyelids seem to be symmetrical to both on the left and the right side. So ma'am, could you close your eyes tightly for me
Okay.
and open them up? So patient has no trouble opening and closing the eye. And the eyelids are covering the part of the sclera, which is normal. Now we're going to continue to assess the patient's palpebral conjunctivae. So ma'am, could you look down for me? So I'm gonna pull on your lashes a bit. Okay. Remember to wear gloves as you do this procedure. Now the other side. Do you feel anything? So there's no swelling, no presence of foreign objects or anything felt by the patient, as I did check the palpebral conjunctivae. So now I'm gonna proceed to palpating the lacrimal glands of the patient. Ma'am, is it okay if I touch your face?
Yes.
Okay, so there seem to be no swelling and everything is normal with the lacrimal gland. So now I'm going to proceed to touching the nasolacrimal gland. Can I touch your face again, ma'am?
Yes.
Do you feel any pain as I touch it? Okay, so patient feels no pain and there is no presence of swelling. Now I'm gonna proceed to assessing the conjunctivae of the patient. So ma'am, is that okay if I touch your face again?
Yes.
So could you please look up? Okay, patient's conjunctivae is pinkish in color. There seem to be no foreign bodies or any type of swelling or infection. So patient's conjunctivae is normal. For the sclera and cornea, patient's sclera looks perfectly normal both on the left and the right side. And there are no abnormalities with the patient's cornea both on the left and the right side. So sclera and cornea is normal. Now we're gonna proceed to assessing the patient's iris. So the patient's iris is dark brown in color, but these are in the same size. So the normal iris size should be 10.2 millimeters to 13 millimeters. Now we're going to proceed to checking the constriction of the patient's pupil. So I dim the light. So ma'am, I'm gonna check your eyes, okay? I'm just gonna shine a light on your eye. Is it okay with you? So I want you to look at that object right there. And I'm gonna start. the pupils are constricting, so both the left and the right eye are constricting as it should, and it is normal. So now we're gonna check for the accommodation of the pupils. So ma'am, I'm gonna shine a light at your eye again. So I want you to look at that object again. Just look straight ahead. So I'm gonna start, okay? Okay, so both pupils are still constricting to the left and the right. Both are responsive to the light. So now, ma'am, I want you to look at my finger as I shine a light on your eye, okay?
One.
So both pupils are still constricting both the left and the right and reactive to light. So it is normal and it has accommodation and it is responsive to light. So what I'm going to do is show fingers on the side while one side of your eye is covered. So you're just going to tell me how many you see, okay? So let's start. Can you cover your right eye for me? Can you tell me how many fingers are there?
One. One. Two. One.
Okay, could you blink for me? Now for the left eye.
Here. Two. Zero.
Okay, so the patient can identify how many fingers are there. Now we're gonna proceed assessing the patient's ears. So I'm just going to see if your ears is level to the sides of your eyes. So the patient's pin of the ear is almost at level of the patient's eye. So now we're going to palpate for the patient's cartilage and mastoid process. So ma'am, I'm going to touch your face again. Is it okay?
Yes.
So do you feel any pain as I touch it?
No.
There seems to be no swelling with the cartilage. Okay, now the mastoid process. Do you feel anything tenderness?
No.
Okay, there are no swelling and no masses. So cartilage and mastoid process is normal. So now we're gonna assess the patient's ear canal and tympanic membrane. So I'm going to touch your ear, okay? Do you feel any pain as I pull it?
No.
So patient's ear canal is same with the color of the ear and there are no presence of foreign bodies. There are cerumen or wax which is totally normal for the patient. We're gonna proceed to other side. Do you feel any pain as I pull it?
No.
So the patient's ear canal is same color with the ear. There are no foreign bodies and there's presence of cerumen or wax which is totally normal. Okay, I'm going to do the whisper test to test gross hearing. I want you to pluck the right ear and I'm going to whisper 3 numbers and I want you to repeat them to me.
Okay. 1, 2, 3.
Okay, to the other ear.
8, 2, 6.
So, okay, we're done.
Did I pass?
We sure did. Now we're gonna proceed to assessing the patient's nose. So, patient's nose is in the middle of the face or midline. There seems to be no deviations to the left or to the right. septum is normal, both nostrils are normal. So now ma'am, we're going to occlude one side of your nostril. So could you occlude it for me like this?
Yes.
You inhale, you exhale. Did you have a hard time of breathing? Okay, to the other nostril. You inhale, you exhale. Did you have a hard time of breathing?
No.
So patient can breathe perfectly normal even if one side is occluded, sir. There is no obstruction in the nose. So now we're going to palpate the patient's external nostrils or nares. Do you feel any pain as I touch it? So now we're going to proceed to checking the patient's internal nares. So now, ma'am, I'm gonna place my hand on your forehead and then tilt it back. So patient's nasal mucosa is pinkish in color. There are no swelling, no foreign bodies. There are no presence of exudates. There is also no septum perforation. We're gonna proceed to checking the patient's sinuses, the maxillary and the frontal. So ma'am, I'm going to touch your face again. Is it okay with you?
Yes.
Was there any pain? Okay, so there seems to be no swelling. Now we're gonna proceed to inspecting the patient's frontal sinuses. Was there any pain?
No.
Okay, there are no swelling and the patient is no pain as per the patient. Now we're going to proceed to check the patient's mouth and lips. So, can I touch your face?
Yes.
So, patient's lips are symmetrical, both on the left and the right side. There is no lesions, no bleeding, no edema, or any problem with the lips. Can I touch your lips?
Yes.
Patient's lips are soft and smooth. Now we're going to proceed to checking the patient's teeth. So, ma'am, could you smile for me?
Yes.
Can you open your mouth, please? So, there are 29 teeth. The dominant color of the teeth is light yellow and there is malocclusion. Could you please stick out your tongue?
Yes.
Now I'm gonna touch your tongue, okay?
Okay.
Do you feel anything? There seem to be no swelling, no pain, and no presence of exudate. And the tongue is in the midline. It is not deviating to the left nor to the right. So now we're going to proceed to check the patient's uvula. Along with it is of course the soft palate. So ma'am, could you please say to me?
Ah.
So can you say it really long? Okay, so patient's uvula is vibrating or moving as she says which is totally normal and it is pinkish in color. The tonsils are perfectly normal. It is around 2.5 centimeters. There is no swelling also on the uvula or the tonsils. So, Ma'am Charlotte, I want you to bend your head and your shoulder to the left and to the right. Could you do it for me, please?
Yes.
And to the right. Do you feel any pain? So, the patient could do it effortlessly and with no pain. Charlotte, I would like you to bend your head forward and then backward. Forward and backward. Did you have trouble doing it? How about anything? Okay, so patient had no trouble doing it, what I said, and she felt no pain. Patient's neck is movable and there are no problems. So I'm just gonna put your hair at the back. So patient's trachea is in a midline position, not deviating to the left nor to the right. There's no visible jugular vein distension. There's also no presence of thyroid lumps. Okay, so patient's neck is normal as per inspection. Now we're going to proceed to palpating the patient's thyroid, and I'm gonna do the anterior approach. Do you feel any pain as I touch it? How about here? And here? So, patient feels no pain. Now I'm going to palpate for the thyroid. Do you feel anything? Okay, to the left. Do you feel anything? So, patient feels no pain and there is no enlargement of the thyroid. The thyroid is smooth, pliable, and non-tender. Now we're going to assess the patient's lymph nodes. So I'm gonna touch your face again, okay? Tell me if there's any pain. Is there any pain? So how about here? Didn't you have any pain? No. So there seemed to be no swelling of the lymph nodes and the patient did not complain of any tenderness or pain. So now we're going to assess if patient has neck distension. So I want you to tilt your neck a little to the left, please. So as you can see, there is no neck distension. To the other side now. Okay, so there's no presence of neck distension. So now we're going to assess the respiratory system. I'm looking at her face, neck, and thorax. Skin is pink. There are no signs of central or peripheral cyanosis. There are no lumps, bumps, or bruises. Chest is symmetrical. Expansion appears symmetrical. The AP diameter looks to be less than that transverse diameter. She does not appear to be short of breath. To keep neck or breathe neck, there are no intercostal or substernal restrictions and no use of accessory muscles. Her chest is one, no lesions or bumps. No signs of crepitus and no tender areas.
99, 99, 99, 99.
And no signs of tactile kernitus. Okay, there's clear air entry in all lobes at right lung. There is diminished air entry to the left lower lip. I'm looking at her posterior thorax. The skin is pink. There are no lesions, bumps, or redness, and thorax looks symmetrical. As I palpate, the skin temperature is warm. I do not feel any abnormalities. There are no signs of crepitus.
99, 99, 99, 99, 99, 99.
There are no signs of tactile premises. There is clear air entry in all lobes of right lung. There is diminished air entry to left lower lobe. Now I'm going to assess my patient's cardiovascular. I will start with the inspection. So first thing we're gonna do is to look for any lumps, lesions. I'm gonna try to look at these vessels. So can you look up in here? So there she had the carotid and the jugular veins and also the neck. Try to look if there's any pulsation. So I didn't see anything pulsation. And now let's try to inspect her chest, her actual heartbeat, if there's any abnormalities. So let's check if her heart is beating at this point. So I didn't see anything like that and it looks so fine. Next thing we're gonna do is to palpate. So let's start with the temporal pulse. And carotid pulse. And the apical pulse. Right in the mid-clavicle optic intercostal space. And the brachial pulse. And the radial pulse. So I'm gonna palpate the drugs. We're feeling any bruise and actually feeling a turbulent lab. So I'm gonna use my hands and put it right under the clavicle. So I didn't feel anything turbulent, though she is normal. So we'll be doing the auscultation and we're going to use the bell of the stethoscope. And try to listen to normal pulsation and any bruise. Okay, good. She seems so normal. I didn't feel anything. So, Gana auscultating the normal heart sound. So, the normal heart sound is lab, which means S1 and S2, opening and closing of all those pulses. So, we have 5 pulses we're gonna be assessing. So, the first is the aortic valves. So, here the sound should be hearing loud. Here is the S2 and the pulmonic valves. So it should be the loudest because it is in the bottom of the heart. So the third is the Erb's point. It's gonna be referred to your third and fourth intercostal space. So it should be equally means your S1 and S2 will be here at the same time and same pitch. Okay, so the fourth intercostal space you're gonna get in here is the tricuspid valve. So the tricuspid valve you're gonna hear is S1 loudest because you're going towards the top of the heart. Then the mitral valves. So you're gonna be hearing the S1 louder. Okay, so now I'm going to examine your abdomen. So we need our patient to lay down on her back in a supine position. So kindly lay down. Okay, so before we start, I'm going to ask you some questions. So, do you have stomach issues right now, ma'am? So, when was your last bowel movement?
This afternoon,
And do you feel pain when you pee?
sometimes.
Okay. So now let's start for the inspection. So we are looking at the contour of the abdomen. There's you could have the protuberant abdomen, the scaphoid abdomen, sinking of the abdomen, and flat abdomen. And as I can see, she is fairly normal flat, no obviously masses or anything is sticking out. But sometimes when she pees, she felt pain. We're going to auscultate before palpating with the abdomen. And when you auscultate for bowel sounds, typically it's with the diaphragm of the stethoscope. First they start usually in the right lower quadrant, because they are often caught in here right away. And they are normally like high pitch or gurgling or cascading sounds. And also you want to know if they are hypoactive, hyperactive, or absent. And you're going to move in a systematic function to all four quadrants. We're going to light palpation, and what you're gonna do is to use 4 fingers and go about 1 cm down and do it clockwise. Do you feel any pain?
No.
Look at her facial expression if she is grimacing when you palpate. So, is it painful as I palpate it?
No.
So, she has no pain, the abdomen is soft, and no obviously masses or lumps noted. Now, I'm gonna be assessing your musculoskeletal, which is your muscles, joints, and bones. So, I want you to ask if you have any history of muscle pain, previous joint, previous sport injuries, inability of your bones, those of its function to move, any history of arthritis. Okay. Okay, thank you. So, I'm gonna start. So, now I'm checking for any swelling. Is there any?
None.
And now, I want you to open your mouth. Chin out. Chin in. And side to side. So, I'm gonna check for the head. So, I want you to look upward and downward. Then, side to side. Now, put your head on your shoulders to the left and to the right. So, for your spinal, I want you to stand up. I'm gonna check here. Can you bend down? The pulsation is okay. So, I'm gonna continue with your elbows and your arms. So, I want you to do it like this. And down, forward, all the way up, behind your head, and it down again. Put it in your back and do this. So it was all okay. Now for your elbows, I want you to go against my force by shrugging your shoulders. Now I'm gonna palpate. Is there any tenderness? Next is for the elbows. Is there any tenderness?
None.
Now I want you to do this. And I want you to go against my force again. Okay, good. Now I want you to do like this. And your wrist down. And wrist up. Is there any pain?
None.
Okay, now do it like this. Okay. And fold your fingers. Now I want you to go against my force again. Okay. Next is hips. I'm gonna palpate it. So, do you feel any tenderness or pain? Okay, next is your legs. I'm gonna move it like this. And up. In. And out. Is there any tenderness or pain?
None.
Now can you go against my force? Okay, good. Now to the other legs. Now go against my force again. Yes. Okay, good. You sit down. I'm gonna palpate your toes. Do you feel any pain or tenderness?
None.
And can you tiptoe?
Yes.
Now I want you to go against my force. Okay, good. Now I want you to do your feet like this. And out. Straight. Okay, it's all good. Now I'm gonna palpate the knees. So is there any pain or tenderness?
None.
Now I want you to put your legs up. Now the other side. And I want you to go against my force. Okay, good. To the left. Good. For the spinal, so now I'm gonna check for the symmetry of the neck, shoulders, scapula, hips, and curvature of the spinal. So I'm gonna palpate here. Is there any tenderness?
None.
Okay, I want you to move forward and bend this. So the scapula is in C shape, which is okay. Stand straight again. Then for your cervical, it's natural to have curve. Then for your lumbar, okay, so overall, your range, your strength, and your ability to go against my force are normal. So, Ma'am Charlotte, after assessing you from your head to toe, all findings seems to be normal, no complaints of pain, tenderness, or no abnormalities.